Hi guys, this is Dr. Patil, your friend and your medicine educator for Unacademy Plus platform. Now, I had been teaching medicine for quite some time, and then having interacted with you, I understand that some of you are absolutely in love with medicine, and then you are stuck in a situation where you have to make a judgment that between MD and DNB. I'm not talking about the superiority or inferiority of one over the other. I'm talking about the situation where either you're not getting MD medicine at all and DNB is something that is in your reach, or you may be getting MD somewhere, but then you are making a judgment about the expenses that I need to incur because I'm getting a seat in private medical colleges. And will I be able to pull it off being a DNB PG student? Like, will it be easy to pass? Will I get stuck? What would be my future? Like, I know such things are bothering you, and I have been getting a lot of queries about it. So today, one of those queries I'm going to address, that is about how to choose the right DNB institute. And let me put a disclaimer: I'm only talking about general medicine. Now, I'm not a surgeon. I don't have an expertise about surgery, and I cannot talk about how to choose the right surgery DNB institute. Right? I'm only going to talk about how to choose the right DNB medicine institute. Okay. So, but before I put out my perspectives, let me also introduce you to something that Unacademy is beautifully doing. That is the Unacademy Plus subscription. Right now, you guys are connected to me on the YouTube platform. But Unacademy has its own application, and it has a plus subscription where all the branded big shot educators of the country come live and teach medicine. And trust me, guys, this could be very useful for you even when you get into your PG. Because nowadays the bar of NEET PG entrance exam itself is so elevated that the topics that we are covering, the depth that we're trying to cover is almost close to what you would be learning in your PG. So it may be still useful even if you are now considering possibly getting into DNB. It may be still useful, and I would strongly recommend considering that. And apart from that, those of you who are still in the dilemma whether I will take up a DNB this time or should I think of dropping off and try next year. So if you're dropping off, trust me, you will be finding it really useful. So do consider getting on to plus subscription. And if at all it works well for you to listen to the pre-recorded lectures, right, then you can get an iconic subscription where you will be getting Unacademy plus Prep Ladder both together at a reasonable price. So definitely give a try, guys. Yeah. Now let me take you to the important issue that I wanted to talk about: how to choose the right DNB institute for medicine. Again, a repeat disclaimer: I'm talking about medicine, not about surgery, pediatrics, or any other branch. I have zero expertise about that. Okay, so to make these recommendations or to guide you through this process, right, I'm making some assumptions, and I'll tell you why I'm making those assumptions. So what are the assumptions that I'm making? Right, my first assumption is medicine needs good reading. Now, if you're already in love with medicine, or if you are prepared for entrance exam, you guys know that medicine is something which needs constant reading. I myself, now being an educator for some time, I'm still not fully updated, right? I'm not aware of some of the latest guidelines. When I come back live to teach you about those topics, I still need to find time, squeeze in some preparation of that time, like make some use of that time to update myself about the recent guidelines, because medicine is one branch which is ever changing and ever growing. So the amount of information that you need to learn to pass your MD or DNB exam is increasing every year. And every year the guidelines are changing. Harrison today, whatever we have, is an outdated book. And I'm making this statement in all my senses. Harrison's current edition came in 2017. Where in 2021, this year the new edition may come. And during these 4 years, every year, most of the guidelines were changed. Like for example, if I were to talk about diabetes mellitus, right, the ADA guidelines. They come every year, and every year there is some new insight. There are some new drugs being recommended, some new targets being set. So it is an ever-changing field. Then when it comes to COPD, we have this gold guidelines, right? So that changes every year. Then when it comes to asthma, right, we have this GINA guidelines, right? We have this GINA guidelines. That changes every year. So our recommendations, guidelines, the way we manage diseases, the way we diagnose, everything is constantly changing. And what does that mean? That means you need good amount of time to read. And I'm sure right now, irrespective of how intense you're prepared, you're not great with Harrison. This much is sure. You have to accept this, that I'm not great with Harrison. I might have read it once, twice, but then Harrison is a gold mine. Every line, every statement makes a lot of sense. Every line and every statement is backed up by like terabytes of data, terabytes of research. So you can't discount it off just like that. So the first assumption I'm making is that medicine needs good reading. It is not only about spending time with patients. So if it is surgery, it is more about hand skills. Right? It is about spending time more with the patient and more inside the OT than with the patient. But when it comes to medicine, it is about spending time. I don't say that you should spend more time with the books and no time with the patient. Obviously, no. But you need a reasonable good time to be spent with books. So that means you should probably be choosing an institute which is giving you the right balance of that. And that is why I'm making this assumption. Medicine needs good reading. The second assumption I'm making is this: hand skills are less important than mental skills. And some of you may not agree with my point, but trust me, those procedures and all are not what you will be recognized as an internist for. You will not be recognized as a great physician who does an awesome lumbar puncture. You will not be recognized as a great physician because you do an awesome pleural tap. No. A physician is the need of the hour because we diagnose the cases efficiently and we give the direction for further management. I don't say that we manage everything under the sun, but we give the right direction for further management. And reaching out to the diagnosis is the most important thing about managing any case. And that is the beauty of medicine. And if you are planning for medicine, I know you're planning for medicine because this is what your love is about, right? Reaching out to diagnosis, evaluating and working up the case and reaching out to the diagnosis. So there is less about hand skills and it is more about mental skills. And these mental skills can be acquired only when you are working in an environment where you have reasonable time to spend for patients. If it is a too busy place, right, then you are not going to do that, right? So for example, if you have a neurological case, right, you have a neurological case, if you have 5 minutes time, you are going to examine everything. Right, quickly as a PG, 5 minutes is more than enough to do a thorough neurological examination and you can finish that and you will have a fair good of idea at the end of this 5 minutes of examination. But if you don't have that 5 minutes time, you are having some 3 or 4 ward calls waiting on your head, and there is also a case in the ER for triaging, and then also a professor has asked for some information. So if all that is sitting on your head, you won't be able to spend 5 minutes for that neurological case. And what do? You prescribe an MRI and move on. Or maybe you will just tell if it is a DNB Institute where there are some interns also posted, right? Or if there are JRs working after their MBBS waiting for their entrance exam, you will ask them to work up the case and report to you. Beyond that, probably you will not be able to spend time, right? So to pick up those hand skills, the mental skills I'm talking about, to pick up those mental skills, you need to choose a DNB Institute where apart from getting good number of cases, you will be able to get time to work on those cases. Otherwise, it is absolutely futile. It is absolutely futile. So I would personally believe that running behind those medical colleges where you will be seeing 100 plus OPDs in a given day is a waste judgment. Okay, I know you may blame me for this this assumption, but I'm not in favor of that. And many of you would start believing in this once you finish your MD or DNB, whatever it is. You'll start believing that this running behind a very busy place is not the great thing, at least when it comes to medicine. And it may be a great thing when it comes to surgery. If you cut open 100 abdomens, you're definitely better than someone who has cut open 10 abdomens. But when it comes to medicine, it is about developing a very holistic approach to a case. And for that, good amount of reading, good amount of time spent with your peers, like talking to your colleague PGs, senior PGs, junior PGs, your junior faculty members and senior faculty members, where you learn insights into management of case. That is very, very important. So if you're on the toe always, then I wouldn't see that you're becoming a great physician. Right. So that is the second assumption I'm making. And the third assumption I'm making is one can pick up the missing skills quickly after DNB also. Yeah, this is something I will assure you that, because I'm also from, I also done my DNB from an institute where there was not too great of bedside presentations happening or bedside discussions happening. The consultants used to rush in, do the rounds and walk off. So I did put some effort. Back then I didn't have the resources that today are there available. So I did put some effort to learn medicine the way I had to learn. But I can assure you that whatever I missed out, I really burned too much of my energy to learn some skills that I thought I'm missing out. Right. So to present a case of neurology, I used to travel 30-35 kilometers to another distant hospital where I know weekly once they present a case. And to accommodate this case presentation, I used to do a previous day night duty, additional night duty, so that I can take this first half of the day off and then travel and then be part of that case presentation. But then I quickly realized after my DNB that so much of effort is not needed. Absolutely not needed. Right? If you feel that you're not great when you pass out of your DNB, you can quickly acquire those skills which are missing in you. Hardly 6 months of senior residency in one of those so-called busy places, and you're parallel with anybody else. Right? So do your DNB and then get into a government medical college and be an SR there for 6 months. Fair enough. Right? You are as good as any MD from any institute in India. Whatever is missing, you can accommodate. Right? So the first point is always about learning the theory and an approach to case, and about passing your DNB exam. So if you're not learned theory, even if you have got all these hand skills, you've done 100 plural tabs and all, it is not going to help you in any way. You will become a glorified duty doctor after your DNB if you're not cleared, right? So remember this, even if you are landing up in an institute where there is no absolute bedside discussion, right, no one is going to give you a guidance, still don't worry. Just make use of these 3 years, learn the theory and approach that you need to learn, and definitely you can supplement your preparation with the online resources. And once you have your degree, whatever is required to be learned, to be I'm not saying that medicine is a never ever changing field and it is a lifelong learning, but to be equivalent to your peers and colleagues who are MD pass outs or a DNB from a very great institute, you only need 6 months of additional time. You will pick up everything that you're missing. Just pick up a good place to do your senior residency and you're done. Right. So these are the 3 assumptions I'm making, so that based on these assumptions my recommendations are based. So don't blame me later saying that, sir, you said this institute is great, go there, or that institute is great, go there. No, my recommendations are based on these assumptions. Okay. Now, based on the assumptions that we made, let me tell you the guiding points for choosing a good DNB institute. Okay. So the first point I'm saying is prefer an old DNB institute over newly recognized. These newly recognized institutes may be great. I'm not disposing them off. And if you're not getting such a great institute, pick up anything you're getting. I told you, it's only 6 months of effort and you can pick it up. So, but if at all you have the flexibility of choosing the good DNB institute, prefer something which is an old institute. Like it is having DNB for last 10 years, 15 years or 20 years, 30 years. Most likely a system would be in place where like once you land up as a DNB PG, you will have seniors to guide you. There is already man force. So you're not too much burdened with duties. And when you have grievances, when you have difficulties, there is someone around the corner who will be able to help you out with. Like you're stuck with your thesis, then someone will be able to guide you because it's a well-established place where the processes are established. It's always prefer an old DNB institute over new one. I keep getting these queries about, sir, district hospital is now converted to a DNB institute. Should I prefer? So no, my recommendation would be prefer a DNB institute even if it is a corporate hospital which was running DNB for many years rather than pick up a newly recognized DNB institute. It may have a great patient load, but it does not have an established process to help you, and your rotations, all that will become haphazard and random. And if you're first DNB PG, then there will be too much expected from you and you might find it really difficult to cater to that expectations of faculty members. So I would say prefer a old DNB institute over a newly recognized institute even if it is a government hospital. Okay. Then the second recommendation is prefer a DNB institutes with more than 3 PGs. The 2 important advantages, obviously if there are more than 3 PGs, right? So 3 years DNB, if you have already followed this guideline, right, and 3 years DNB, then at any given time there are 9 PGs and they are rotating. Some of them will be rotating through super specialties, but at least 4 or 5 will be in general medicine. And then you're not too much burdened with duties basically when there are more than 3 PGs. And you also have a very solid support system in place. Yet you're not feeling well in a particular day, then you don't need to pull off and come into a hospital for doing duty. Someone will be able to pitch for you, say that I'll cover man, you stay at home, you do when I need. Right? So that support system would be existing. So if it is only 1 or 2 DNB students, it will be very difficult for you. Like one goes into super specialty rotations, then every burden will be the other person. But still, if you're in love with medicine and you need to get into DNB and it is not possible to get into MD, don't think twice. Just take whatever you're getting. That is my recommendation. Just take whatever you're getting. But when you have flexibility, this is what I'm telling you. Follow this, right? So prepare a DNB institute with more with more than 3 PGs. Then prefer a DNB institute with more than 500 beds. Okay, this I wouldn't strongly vouch for, but because now that MCI guidelines say, the NMC guidelines say that if you've done a DNB from an institute where there are more than 500 beds, then you will be counted equivalent to MD medicine and you don't need to do a second one additional year of senior residency. So keeping that in mind, if at all you think of a career in medical college, right? I would never think of a career in medical college because I know medical colleges can never compensate you for your effort. Right? So even if you retire as a professor of medicine, you will not have sufficient savings in your accounts, because whatever medical colleges can pay you today can only help you sustain, not grow anything beyond. And with passing time, it will become very difficult to practice outside once you are in a medical college, because the NMC will be keeping a close eye on that. So I would say, if at all you're so passionate that it's okay to compromise an income, but I want to be a good teacher, and this time I'm missing out MD medicine, but I still want to be a teacher, well, then look for a place where there are more than 500 beds. And another recommendation is that look for a place where they have faculty from medical college who are retired and now working in the DNB institutes as consultants. They may be able to teach you better. Right? They are routinely doing it in the past, so they are accustomed to teaching the DNB students. I mean PG students, so they will be able to guide better, if at all. Now, how would I get to know that the teachers are PG medicine or something? Then just do one thing. You can come on to Facebook or my Telegram channel, which is called Dr. Patil's Medmania, and just drop a text to me saying that, sir, I want the list. So we have a list where the faculty members and the institutes and the number of seats are all kind of compiled based on the NBA website's detail itself. That may be able to help you. So where you can click the link and go to the NBA website's faculty details, and you will be able to know whether they are having teachers recognized as PG teachers by MCI, or it is only the consultants who are there. And that would be a fourth guiding principle. So choose based on this, and hopefully you will land up in a good place. Hopefully you will land up in a good place where there's a right balance of work and time for studying. Right? Okay. Now, if at all I can't get a good DNB institute, how to make the most out of my residency? Right? You said pick up something where there are more than 3 PGs, where there are more than 500 beds, there are PG teachers, and which is an old institute, like only few fit into that category, right? Gangaram or Baptist, St. Martha's or something like that. So if I'm not getting into that place, I still want to come out of DNB in single attempt. I want to be a good physician. So how can I make the most out of my residency, right? So here are my suggestions. First one is learn to manage your time efficiently, because your institute may not be keen to give you time. Right? So manage your time. Always squeeze out some time for yourself, right? So trust me, you are more important than your career. You are more important than your studies. So always manage some time for yourself, for your recreation, relaxing, hanging out with your friends. Always make time for that. Right? The more mentally healthy you are, you do better as a PG. You pass easily in comparison to more stressed and freaked out you are. And then also make some time for reading. And rest of the time, I think institute will squeeze out of you. But always try to make some time for reading and some time for yourself, so that you're physically fit. You're doing some basic aerobic exercises at least 45 minutes per day for at least 5 days a week. That is a standard recommendation, so that you're mentally also fit at the end of your 3 years. Okay, so do that. And then you can definitely supplement your learning from online resources. I will definitely be able to tell you what are those good online resources. Okay, in the subsequent slides, I'll tell you what are the good online resources which are ideal for a PG student. I'm not talking about a UG level material, something that is ideal. Whether you are able to pay or not, you will have a solution, right? And then there will be a lot of practical workshops conducted. Even if there are no bedside discussions happening in your institute, there will be a lot of practical workshops conducted, and they will be useful for you. You can attend them. So one example I can give you is MERT. It's called Medical Education and Research Trust. Right? This is part of the Association of Physicians of India. So like we have an organization. Once you finish your DNB, you will also become a member of it. It's called Association of Physicians of India, and they have a subsidiary called MERT, Medical Education and Research Trust. So every year, at least in Bangalore, I don't know about the other state capitals, but at least in Bangalore, the MERT conducts a 7-day or a 5-day workshop where MD as well as DNB students come to present cases, and some stalwarts in terms of faculty who are well established as examiners, PG level examiners, come there as assessors or examiners. So you will learn how to present a case and how examiners frame questions, how do they catch our mistakes. All that you will learn in that. Those 5 or 6 days will be really, really high yield. Right. Similarly, Dr. Kundu, you know his MCQ, the bedside clinic book, right? Dr. Kundu, Arup Kumar Kundu. He also runs a workshop once in a year or twice a year in Maharashtra and Kolkata, I believe. So you can attend those places where you will be able to get that missing link between you and the great bedside presentation, right? So you don't miss anything. There is always a solution. There is always an alternative. So take DNB if you are getting, even if it is not a great institute. Okay. Now let me tell you some good online institutes. if you are preparing for like you are already entered into DNB, whether you are preparing for NEET super specialty or not, even if the aim is just to pass the DNB, I would highly recommend you to consider Prep Ladder SS subscription. And I'm not saying this because I'm a faculty for the Prep Ladder SS. Along with me, Dr. Dilip is also there. Now you recognize him as a very good medicine teacher. And I'm not saying that it is Prep Ladder the only thing that would be helpful. Apart from that, yes, there are other competitors also who also have done excellent work when it comes to PG studies. Now, with respect to Prep Ladder SS, I would say we have compiled lectures which are mirroring what is happening. Sorry guys, I lost the signal for some time in between, but okay, let's get back to the topic that we were discussing. Now, I was telling you that there are good online resources for PGs also, and Prep Ladder is one of them. I'm not telling you that this is the only thing and you should all vouch for it, but this is one of them, and where we have put some effort and try to do something which is really useful for the PG students. Like the content is at the PG level, and by February we will be coming out with the version 2.0. Dilip is on it and I'm also on it, so we will be recording and coming out with the version 2.0, and that will be helpful for you not only to get through this DNB or DM super specialty entrance, but also pass your PG exam. We are literally trying to cover everything that Harrison is addressing, that everything that is expected from a PG student, we're trying to cover that, so you guys can definitely pay attention to that. Okay, but apart from that, there are other good resources also. I don't say that Prep Ladder is the only good resource, but definitely Prep Ladder is something that you can bank upon. But there are other good resources, so choose whatever works for you. In a sense, what I'm trying to say is that even if you are in a DNB Institute where there are no great teachers and nothing great is happening during the rounds, and no seminars, no bedside teaching, and no classes are being conducted, still don't worry about it, right? This Prep Ladder SS or the other competitor platforms will be able to give you a good learning material. So you're not missing out on that. So when I was doing DNB, all this was not existing, right? I had to go to some other hospitals where classes were being conducted to attend. So this is something that is useful in the current time, right? Then apart from that, EETCM. What is that? It's a YouTube channel by the Amrita Institute of Medical Sciences, their emergency medicine department. The head of the department, Dr. Girish Kumar KP, and his team is doing really a good job. So you will be able to see a lot of free YouTube content about emergency case presentations, how the cases present, how they work up. And I would feel that that would be really helpful, because when it comes to DNB, your practical examination is not only about case presentation, it is about being part of the ward rounds, right? So there are OSCE stations, and then you go to ward rounds, and there will be bedside discussions about those cases. So the conventional bedside discussion about short cases and long cases is pretty predetermined, like it goes in one particular direction until and unless you drag the examiner to some other direction. But when it comes to ward rounds, anything relevant to that case can be asked. So it is not restricted to those typical maybe some 60-70 important bedside cases. Ward rounds could be anything under the sun, like anything that is relevant for medicine can be discussed. So remember that this channel could be helpful for you for that. Okay, then apart from that, there is Prep Clinic. Prep Clinic is a Prep Ladder's subsidiary, and there in the Prep Clinic for the medicine, Dr. Giriraj, he is also a dear friend, one of my ex-colleague. He has recorded the bedside discussions, and trust me, this bedside discussion is like quite at that level of PGs. This is not that basic bedside discussion that I routinely do on Unacademy or any other platform that are doing for UGs. This is a proper PG level bedside discussion. Everything that you need to face your DNB exam is covered. This is something that I can assure you, that everything that you need to face your DNB exam is covered. He has touched every minor case, every major case at great detail. You don't need to really depend on any other source for your practical exam. He's done a good job, and I think you can bank on this. Apart from that, yes, there are workshops being conducted. I spoke to you in the previous slide. Those are also going to be helpful for you, especially to pick up the skills, basic examination methods, all that. And then whatever the examiner is going to ask you, pose questions to you, those you can easily answer by whatever Dr. Giriraj has covered, right? So you can consider that. Then Unacademy is also something that I want to draw your attention to, because you guys know that the NEET PG now quite at that standard now, and Unacademy educators are doing a good job. And if you are subscribed to Unacademy, probably you will be able to learn through direct interactions, right? You have a PG level doubt. Mostly, I don't think any educator would say, "Don't ask me a PG level doubt." At best, he would say, "Okay, I don't know about it right now. We will come back and discuss it in the subsequent session." So you may consider even subscribing to Unacademy as your source of learning medicine. Now, whatever we are covering at Unacademy is quite at the level, not I won't say at, exactly at the PG level, but it is definitely UG plus level. So in the first year of your residency, this could be quite handy. You can learn a little bit of radiology, neuroimaging and stuff like that from the radiology faculties, and a little bit of medicine from medicine faculty. So you may consider this also. Then prep ladder NEET PG. Okay, so prep ladder NEET PG is coming out with one more set of bedside discussions. So this mostly me or Dilip will be part of this, and similar venture Unacademy is also coming out with. So either one of me will be on prep, the other one will be probably on the Unacademy. What are we planning to do is we will be having case presentations in a student teacher format. What Dr. Giriraj has done in prep clinic is he takes a case, he presents it to you, then he earmarks the important findings, he demonstrates those findings to you, he talks about how to elicit those findings, positivity means what is the interpretation of positive findings, negative findings, he discusses all that. It's a great way. But you can also supplement that preparation by subscribing to Unacademy NEET PG, where a student, like a prominent student, is presenting a case and me or Dilip are moderating it, right? We are asking questions at the right intersections where examiners have a tendency to stop you and ask questions. Now, if you go through those bedside books and all, it is very monotonous way. I wouldn't say monotonous. It is the monophasic way of presentation, right? So if you read through, you feel like I know everything. But when you're presenting the case, your examiner will stop you at some point and ask you questions which you find it a little bit difficult to answer. So by following this approach, it may be helpful, right? So this is also something that you can look forward. And then you guys know Dr. Najib, right? Dr. Najib Jung. His lectures are like every physician will be in love with it. And most of his content is available free on the YouTube, so you can consider doing that also. And even if you're buying a paid subscription, it is not very expensive. So in essence, what I'm trying to say is, even if your institute doesn't have great teachers, today to supplement your PG learning, there are good online resources. Now, I know most of you probably are not from the medical colleges where great teaching was happening. I don't want to blame the teachers, but you know that they are also hard pressed for time. There are ward duties and patient calls and so many things, and neither medical colleges compensates them so well that after going home they should be preparing for the tomorrow's class and they need to run through their practice. So you know that even when you came from a bad medical college, still you are able to crack some decent rank, right? It finally boils down to you, and you had great alternatives like Unacademy, Prep Ladder, Marrow, Bhatia, whatever. Like you had good online resources for you to prepare as an alternative, even when your basic teaching in the institute was little on the substandard side. If it was good, great. Same thing with DNB. If you are in a DNB institute where there are great academic, great, not a problem. But if it is not great, don't bother. You will find some resource like the ones that I have listed. I mean, it is not the extensive list. You will find some resource to supplement your preparation. So don't worry too much about the academics in the institute. That's what I'm trying to say. Okay. And then next thing I want to specifically tell you. Now I start looking at you as my near future peers or colleagues. Okay. So some of you may become educators. Some of you may become great practitioners. Some of you may become super specialists. But then, now we are in the league of colleagues or peers. So listen to what I'm going to say now. I'm going to drop some important names in front of you. And those names are really something that I have loved listening to them as a PG, right? And as a practitioner, they have made a contribution to the way I practice medicine. I don't say that they are research stalwarts, but they're great speakers. And if you get a chance to attend to their conferences or seminars online, for next some time it's going to be online seminars only. No major offline conferences likely to happen. And these are big names. So as a physician, you should listen to them. So if a conference is organized in your city, or if it is an online conference and you see these names, I would say please listen to them. It will make you a better physician. It will make your chances of getting DNB medicine completed in one shot little more easier. Right? So what are those names? Let me tell you. Okay, Dr. J.V. Peter. I think he is from CMC Vellore. I'm not very sure about his institute. Right? He's doing a great job in terms of critical care medicine and OP poisoning. If you get to listen to OP poisoning lectures from him, just don't miss out on it. Literally, just don't miss out on it. You will be part of a very rewarding experience. You will feel that you now know the OP poisoning in its minute, finer details. Listen to him whenever you get an opportunity. Right? Similarly, now toxicology is something that you might have heard me, Dilip, Deepak Marwa and many people talking about. There's a tendency that toxicology cases are usually mismanaged. First of all, the problem is that they're not suspected. They are usually masqueraded as some other case and usually misdiagnosed and thus mismanaged. And you become a good physician if you are able to become a good toxicology physician. Because in the ER, emergency people will stabilize the case, and after that, toxicology cases actually fall under medicine still now. Though super specialties are evolving for various branches, toxic cases are still something that physicians have to manage, right? So please listen to Dr. V.V. Pillai. He is the HOD of Forensic Medicine and Toxicology, if I am not mistaken, from Amrita. He has his own toxicology textbook, which is also a great resource for PG level preparation. And they have a toxicology society or something, and they have their own Facebook group and a YouTube channel. So search for that and listen to them about all poisonings. They will be a great source for your MCQ learning, because a lot of toxicology related MCQs are possible in NEET super speciality. And it is also possible that in near future the National Board of Examination may introduce a DNB MCQ paper back. It was there for quite some time back. For many years back, there used to be one paper which used to be MCQ based. So, and there I used to find a lot of MCQs from toxicology. And in NEET SS also, there will be at least 1 or 2 questions out of 40 or 150. There will be 1 or 2 MCQs from toxicology. So it is good to learn from this guy. Keep watching for him, like on YouTube or on offline conferences. The other guy I want you to listen to is Dr. Alladi Mohan. Dr. Alladi Mohan is SVIMS Tirupati, and he is the head of pulmonology and general medicine. Right? And he has also done a good work in the field of pulmonology, and is a great orator. So any lecture that he delivers, right, it will be cemented in your brain. You learn that quite well. So listen to him also. Right. Apart from that, the other names I want to suggest you is Dr. Shubha Padke. Now, medical genetics is something that internal medicine people have ignored for quite some time. It was more of a pediatrician's territory, because earliest way the complex syndromes are detected is during childhood. But now we have started understanding the importance of genetics in adult medicine, right? So when we were recording NEET SS videos, I thought I want to record the genetics portion, because I know the bright future that genetics has, and I have tried for the NEET SS. I had got great ranks. Though I'm not pursuing the DM in that, I'll tell you that this is a very exciting branch. And if you understand genetics well, right, you will see a lot of words about genetics appearing every now and then in your medicine textbook, Harrison. He says heteroplasmy, or he says SNPs, polymorphism. A lot of words are thrown at you at different chapters. So if you understood genetics well, that makes those words make a lot of sense. And I would say, if you are fortunate enough to listen to Dr. Shubha Padke deliver any lecture on genetics, just listen to it. Just go for it. Okay. Similarly, a youngster, maybe of my age, Dr. Harish Mallapura Maheshwara. So I think he is the head of critical care in Narayana Hridayalaya, Bangalore, and he has a YouTube channel, and he's doing a great work when it comes to critical care medicine. His lectures are really phenomenal. They're like a top-notch PG level kind of lectures. So if you have an opportunity to listen to him on YouTube, do listen. Or if when you're reading Harrison for critical care, search for his videos on YouTube and supplement that. They're a good resource. Especially if you're inclined to do DM in super specialty critical care medicine, well, he will be a great inspiration for you. Similarly, a few more names I want you to pay attention. Right? One of them is Dr. Jimmy Lal Kaka. He is a neurologist from Mumbai, and man, what a orator! Right? You will fall in love with neurology, and some of you may end up taking neurology because you heard him speak. So listen to him. And in fact, once I got to attend a session where he was an orator, and it's like, that is actually the first time I decided to read neurology. Otherwise, I had always thought I will just do some important questions for the exams and manage my exam. Only after I heard him, I started reading neurology, and then I started discovering the beauty of neurology. Right? Otherwise, what we think neurology is like a dead-end branch where nothing much we do in terms of treatment. We just diagnose and discuss bedside a lot and leave it. But no, after listening to him, I really realized what is the beauty of neurology. He's a great orator, and listen to him if you have an opportunity. Similarly, Dr. Rohini Handa for rheumatology and immunology. And this team of endocrinologists, Dr. Karthik, Om Lakhani, and Mohan Chanai, these are great orators. And they have a group of endocrinologists, youngsters especially, and they keep organizing sessions and online presentations. And trust me guys, endocrinology is such an important topic, important segment of general medicine, where it will earn you bread and butter in future as a physician. If you're in the periphery, these diabetics are going to be your bread and butter. Similarly, when you write a super specialty entrance exam, if it is going to be general medicine based paper, trust me, a sizable number of questions are going to come from endocrinology. That cardio, neuro, nephro, gastro, the core four medicine branches are now being sidelined by the assessors or exam paper setters. So endocrine is gaining a rapid importance when it comes to MCQs, and these guys cover the topics which are relevant for today. So when you are PG, you need to know the topics which are relevant for today, not what is Harrison 17th, 18th, 20th edition is covering. Those are kind of not relevant because things are moving faster than the rate at which Harrison is producing editions. So listen to them. You will be really happy that you will feel that you learned a new insight into endocrinology. Right? So these are my suggestions. So what do I say? What I suggested to you? I said choose your institutes based on these guidelines. Right? So keep that in mind. And if you're not getting, don't worry. You can still supplement your preparation with various resources like online, the ones I spoke about. Offline, a lot of workshops are happening. And then also I said, like, attend to these conferences so that you become a confident internist in that segment, right? And then if you have any doubts about DNB, not only now, right, later also when you get into DNB, you have difficulty in getting your thesis approved or any other thing which you find that I would be of any help, you can connect to me on my Telegram group that is called Dr. Patil's Medmania. Anything about internal medicine, I'm quite crazy about medicine, so you guys are free to post your queries. You can shoot it to me and I'll make my best attempt to resolve them. Okay, so here's me wishing you best of luck. Okay. Whether you're doing ND, whether you're doing DNB, whether you're in a great institute or a bad institute, trust in yourself. If you've decided to become a good physician, no one can stop you. If you've decided to become a good surgeon, then you need a good surgeon mentor. You need chances. But if you've decided to become a good physician, it is you who make a good physician. No one can stop you. Trust me on this, guys. Okay, I'll connect to you on another video. See you. Bye.